Nail diseases and problems. Introduction. Are all changes in the nail a sign of an underlying health problem? Select yes or no. Correct. Not all nail changes are a sign of an underlying health problem. White spots or vertical ridges are harmless. When should you contact your healthcare provider about nail changes? Choose one of the following options. 1. If a nail changes color. 2. If nails become too thick or thin. 3. If a nail changes shape. 4. All of the above. Correct. Also contact a healthcare provider if a nail separates from the skin around it. If the skin around the nail becomes red, swollen, or begins bleeding, you should contact your healthcare provider as well. Ingrown nails most often affect the fingernails. Select true or false. Correct. The big toe is most commonly affected by an ingrown nail. Treatment for a nail infection always includes medicine. Select true or false. Correct. Medicines are commonly used to treat bacterial and fungal nail infections, but sometimes other treatments are successful. Melanoma is a type of skin cancer that only affects the skin under the nails. Select true or false. Correct. Melanoma can develop on any skin surface. Thank you for using Explain.